Hello friends, this is Dr. Rajesh Garg here. I'm a specialist orthopedic working in Dubai. So today we are going to talk about knee arthritis. So what exactly is knee arthritis? So this is our knee, this is the top bone and this is the bottom bone. In between these two bones, this is a shock absorber which acts like a jelly so that this bone doesn't touch this bone, and the front bone is called as patella. So there is a liquid inside which acts like a oily fluid, and the knee moves like this in a smooth fashion. So what happens if you have some joint diseases like rheumatoid arthritis, which in Hindi is called as gathia, or any other joint problems like after injury, and most commonly because of age. When you age, your hair is going grey, your body is becoming weak, similarly your muscles are becoming weak, and the bones and cartilage also become weak. So because of aging phenomena, the fluid, the greasy substance inside the joint, that dries up, and your joint also start making some kind of noises also. So what happens is, because this joint is dried up, and this joint, instead of working smoothly, it starts rubbing over each other. So what happens is, when it is rubbing over each other, so the smoothness of this cartilage, if you can see here, this goes away, and then the joint becomes rough like this. And this is called as wear and tear of the cartilage, and which is also called as arthritis. So you can imagine the smoothness going here, and when it is going to rub over your cushion, the cushion is going to go degenerated, wear and tear, and this will go away. Then this bone is going to start touching over the lower bone. When both the uncovered surfaces are touching, this becomes severely painful. This whole phenomena is called as knee arthritis. So what are the treatment for knee arthritis? So it totally depends upon what stage we are in. Scientifically speaking, there are like grade 1, 2, 3, 4, or we can also say mild, moderate and severe. If you are in early stage of knee arthritis, by taking rest, icing and some form of painkiller as prescribed by your orthopedic doctor, you can get away with the knee pain. As the knee arthritis progresses, you will find that your knee is not bending properly, you are not able to walk properly or climb up and down the stairs, and also doing daily chores of your daily routine life is becoming more and more difficult. That is the time that you should approach to an orthopedic doctor for a proper examination and grading of your arthritis. If early intervention is done, like we can give you some kind of supplements which may or may not be effective. Also, there are intra-articular injections which are quite safe, which can be a steroid or a hyaluronic kind of an injection, which is a component available in that liquid form which provides smoothness to your joint. And also, if it doesn't get controlled by all these means, you have tried doing exercises, physiotherapy, weight reduction, muscle strengthening. All these things are modalities which can help in curing your pain because of knee arthritis. However, one should always keep this in mind. If your knee arthritis is progressing too much, your knee has started bending and your pain score is becoming like 7 or 8 out of 10, then that is the time that one should undergo a surgery. And early intervention can also lead to a small surgery rather than doing a total surgery. A small surgery means even one part of your knee joint is spoiled, you just need a replacement for that cover. So when I talk about replacement, that doesn't mean that we are going to change your whole knee. As I said, in arthritis, only the cover is spoiled. So what we do is we smoothen away this cover and put an implant, which is called as knee replacement implant, over this. So as your exposed bone now is smoothened and it is covered by a new implant, up and down, and the shocker has been placed in between, your knee stops touching, and then you can start moving your knee. So if you are doing an early intervention, you don't need a full knee replacement. If this part is only arthritic, you can just get away with a small surgery which is called as unicondylar knee replacement. So these are the various modalities available for treatment. One should intervene early so that you don't reach to the stage of surgery, and even if you require surgery, you can buy time from nature and maybe you can carry on with the knee arthritis for a longer period of time. And when the time comes, don't shy away to get the right treatment, and that is the surgery for the right treatment is better to get it done.